I want to welcome Dr. Milind Vora to our Zoom stage. This is what we call an Ask Me Anything session, which means that all of you that are out there are more than welcome to jump into the Q&A and ask Dr. Vora any of your questions. Here is your chance to, get some free questions answered, right? It's very rare. You get experts for nothing. That's the Academy is here for. So let me just tell you a touch about Dr. Vora so you know who you're asking questions of. He is the Associate Director of Medical Affairs at Expert Institute, which is one of the Academy's fantastic sponsors supporting everything we do here. At the outset of his medical career, he participated first in residency training in internal medicine with a focus in critical care, and he has extensive experience in MSK ultrasound. He also has co-authored a peer-reviewed book chapter on regenerative medical therapies, which I not only know nothing about, but can hardly say out loud. And he received his medical degree from the Medical University of Leuven in Poland and his bachelor's degree in political science and international relations from the University of Delaware. So to start us out, just tell us a touch about Expert Institute, get us squared up.
Yeah, appreciate it. And thanks so much for the time. It's always a pleasure. Love seeing some friendly faces out there. But yeah, Expert Institute, as its namesake, we're obviously a premier, I think, service in providing great experts. We're pretty much sourcing 1,000 experts in any given month. We customize outreach to really secure, I think, the best potential expert return. But yeah, we have a slew of other services that we're really trying to help out attorneys. We're really, I think, sincere in trying to be patient advocates and ensuring, by reviewing cases, we help out with a little bit of tort reform as well. So we like to play both hats. But yeah, we're really looking forward to it, and we love what we do.
That's amazing. Yeah, I know you guys have lots of interaction and work with lots of trial lawyers, and not just professionally, but on your boards, and you really care about what we do. So we appreciate that too. So tell us a little bit about the typical types of cases that you work on, and hopefully we can, folks can just jump in the Q&A anytime. If you have questions about vetting experts or finding experts or working with experts, here's your chance.
Yeah, and most of you guys probably know most of this. I think I've seen it on many great MedMal websites, but cases that come on our desk, quite frankly, are the usual, failure to diagnose, delayed treatments or diagnosis cases, medication errors, surgical errors, birth injury cases, nursing home negligence, radiology misreads. So we have a place in pretty much every single type of medical malpractice case, and also even complex PI. Eggshell claimants might come in to evaluate, a car accident, see if there are issues with causation for even PI cases as well. So we're really helping consult and also even offer experts in every step of the topic here. Yeah.
That's amazing. I love it. Every kind of expert there is. That's the answer. So what types of things do your experts help do? Do they pinpoint on just causation, liability? What else are they focused on?
Yeah. And there's two services. So we can find you an expert in any realm. We purposely don't have a roster. We actually organically outreach on every case that comes in our door. We never provide advertising experts. Quite frankly, we feel like you guys could probably find those on your own. So we eliminate those. Our goal is to provide, from our expert search service, the most credible expert with your ideal preferences in mind. And then we'll go outreach probably similarly to the ways many of you are doing them, whether it's association websites, Google, LinkedIn. We have physicians outreaching to other physicians on your behalf. So a lot of times the return can be a little bit more fruitful. But our second service, so those are our experts and we can find you any. The second service is our internal medical review process, where we have about 70 now physicians at Expert Institute that are reviewing cases for our attorneys to speak on everything you just referenced. So liability, causation, damages. We have a roundtabling group that will review from every kind of subspecialty that plays into all those three core points. And we provide opinions as a consultative type of service as well to kind of just ensure, plaintiff attorneys are taking on the right cases, and also ensuring, cases that have strong points, which would not incur significant causation, that, those cases don't go forward.
Amazing. So I don't know if you can see the Q&A. Can you click that button? There's two questions that have already popped up from attendees. And I want to make sure theirs get answered before I keep peppering you with questions. So
Sure.
You can read them and take them yourself.
Yeah, are medical experts considering the failure to diagnose for procedures that use machine learning to diagnose breast cancer? I maybe get a little bit more clarification, but I guess if you're asking, maybe we're going kind of far in the future. If you're saying AI is diagnosing a radiologic review, if that's where we're getting to, would an actual individual be able to opine on whether that computer generated radiologic report is actually appropriate or not? It's kind of deep. I'm not sure if we're
all the way in the matrix.
But I will say from a radiology standpoint, so we have 4 in-house radiologists, one dedicated to breast radiology, one dedicated to musculoskeletal spine, and musculoskeletal joints in general, that are being leveraged for objectively reviewing images. And we also have a stroke radiologist as well as general. So what happens for many of these cases is, if you need something reviewed, you think it might be under read, over read, and you want an objective board certified radiologist to opine on the actual image, we could provide that to you from a consultative standpoint based on our internal team, or find you somebody that is, willing or considering to testify based on the case. I hope I answered that question. We can get into kind of AI a little bit down the road if need be, but we're definitely going that route, and even in some of the services we provide. I think the second question here, how do we contact them to see if they have an appropriate doctor for a case that is not a med mal case? So for any time at all, if you had any questions similar to this, I would definitely reach out to either our website, so expertinstitute.com. You could submit cases and you'll get a call, I would imagine within 5 minutes of even the case intake being submitted, to discuss it. And I'll also provide kind of your specific contact. His name's Pat Foley, and he is everything New York State Expert Institute associated, and would be quick to make sure that any need, any inquiry is taken care of immediately.
That's great. He's worked with tons of our members, and sort of has his own like magical Rolodex brain of any possible expert you could ever need on anything. And then he goes and finds more. It's very impressive. So you mentioned that you guys have a whole bunch of radiologists. What other kinds of docs do you have? Or what other kinds of experts do you have?
Sure. Other kind of internal docs that you could leverage to evaluate your cases for screening purposes. We're at about 70 now. So I could literally blast off every single one alphabetically. We're going from anesthesia to vascular surgery and everything in between. But you could imagine our team's robust in reviewing any type of case. We have a birth injury division comprised of OBs, MFMs, and pediatric neurologists or NICU physicians. So when we review a birth injury case for our attorneys to opine on liability, causation, and damages, you get a multidisciplinary kind of approach on that type of case, ensuring that, maybe if there was a delay in getting mom to C-section, having a pediatric neurologist also evaluate some of the unfortunate damages that the child may have suffered is going to be opined on in our review as well, to ensure that it's a case worth pursuing. In some instances, having an oncologist say, no, an 8-month delay in this specific non-small cell lung cancer based on stage is probably not going to be something that would have changed the patient's outcome. knowing that on the front end is usually proven extremely valuable for attorneys every day.
Yeah. What else you guys do besides medical reviews? How about damages? Let's talk about damages.
Yeah. So again, we can find you experts if you need a life care planner, an economist, anybody to kind of go that route. We also have another service called strategic research. So our physician team and our medical writers will curate any type of literature search that you want us to kind of identify. I think we had one come in the other day about Cauda equina. So an attorney asked us to basically give him literature and data that kind of supports why, red flags and early diagnosis of a cord compression is profoundly important. So we provided literature to state, and that shows, why at 6 hours, at 12 hours, 24 hours, and 48 hours, mortality increases directly over that period of time. So you can get a sense. We can curate these to any type of topic that you need. We have access to a lot of paid databases as well that we can get our hands on some great literature, and then also provide you guys some articles that we use to compile the actual document itself. So that's kind of strategic research. And then finally, our kind of last product is called Expert Radar, where we're actually able to find extensive due diligence on experts in general. So another really, really cool, I think, tool and service that has garnered great feedback.
Yeah, and we actually have a CLE coming up that's very specific about expert rate. It's not specific to Expert Radar, but it's Expert Radar and lots of other things about AI, and specifically on vetting experts and like what your due diligence is as an attorney to vet your experts. So that CLE is called Uncovering Expert Vulnerabilities with AI Analytics. And I just went to go find the registration for that to share with you all in the chat. Ta-da! All right, now you can sign up for that. And for that one, we have Dr. Ross Green, who I'm sure you know, and one of our associate board members, Mahaj Ben, otherwise known as Trina, because I can never pronounce her name correctly, Raman, who's going to talk about sort of dig in more on the specifics of that sort of the AI analytics side of things and vetting experts, which is super cool. What else do I want to ask you? What about summarizing medical records? Let's talk about that.
Yeah. Medical records, another really kind of cool service. So we do medical chronologies. We leverage AI technology to basically scrape the entire chart that's submitted to us. And it will not only organize it chronologically to give you every time the client or patient was seen by a provider, but we'll also group it into different organ systems. So if a physician's reviewing it, maybe you had, a major car accident case and you wanted to submit the 5,000 records that the patient has provided, it will be organ system grouped as well. So maybe your orthopedic surgeon doesn't need to look at every single page in the chart. You could click on the ortho group section of the chronology and it will literally pull out all the musculoskeletal related kind of issues and office visits, diagnostic studies pertinent to that specific organ system. So it really helps reduce review time for our physicians. Us physicians love it because it lets us really navigate a chart quickly to our specific specialty, and hopefully reduces attorneys' fees and when they're kind of sourcing those out to the experts.
I love it.
Yeah.
So tell us your favorite misdiagnosed case stories. Come on, give us a couple juicy.
There's a lot.
There's nothing lawyers love more than tell us about a doctor screwing up.
For sure. And what's actually interesting is I feel like when I first started doing this, maybe, speaking to attorneys, both on the plaintiff and defense side, you kind of feel like you're going to the other side. And, I might have been, that might have come up in a couple of my colleagues' discussions, but it's actually really, really interesting over the course of the time. I've been doing this for about 5 years. And I think COVID had a lot to do with it. More and more of my colleagues are actually really, really interested in ensuring that patients get great care. Because I think the pandemic, unfortunately, to many of my peers, felt like they were practicing in a third world, and had seen many instances where they just felt care was not optimized, and not a fault of some individuals at times. I think the system was really just kind of trying to get, to status quo. There was a lot of things that we didn't know and still don't know, and we're kind of just playing with what we were kind of working with, but guidelines were getting thrown out there. People were practicing outside of their scope because they had to. And I think it really just highlighted where there are, systemic changes that could really, really benefit care. Some of my favorite cases come from that. So I review a lot of, sepsis cases, delayed septic shock, delayed sepsis cases at the front of a patient walk into an ER, and if they're appropriately risk stratified, right? So there's a couple things you want to look at that should be red flags. And what was cool about kind of just reviewing cases and doing this at a high level is, yeah, sometimes we found cases where there was a clear delay or a failure to recognize a patient that's in shock in the ER. Empiric antibiotics weren't started, fluids weren't started fast enough. By the time they got to the ICU, the patient was pretty much DOA, and unfortunately there was very little that could have been done. And those cases, worked out. We tried some of those cases. We helped our attorneys really navigate why, early detection based even on surviving sepsis and SIRS criteria is really important. But the best thing about working on these cases, and although there were some bad outcomes for some patients, getting to see kind of EMRs and hospital systems built in sepsis alerts and sepsis protocols after we've reviewed these types of cases is what proved to be profoundly satisfactory. It's what the satisfaction comes into play, and why I feel like, do what we do. Not only hopefully helping out, patients get some, reimbursement for a really tough situation, but hopefully setting precedent to ensure that future care is optimized is why I think we love what we do. So yeah, to answer your question, a delayed sepsis case is great. We work on a lot of misdiagnosis cases where PEs, pulmonary embolisms readily get missed. And some of these things, like an aortic dissection and pulmonary emboli, they're tougher diagnoses, even in the medical world. Like, it's not to say that you can get great care and still literally walk out of a hospital and drop dead from a heart attack. That happens. Even with optimal and great care, if you're risk stratified and in the moment your tropes are negative, your EKGs don't show anything significant, and you got the appropriate workup, unfortunately, yeah, I hate to say it, we're all just one clot away from falling down. And that's a part of it. And that's what we kind of oversee. Now, in other cases where a patient that was tachycardic came in respiratory distress, referenced that they had chest pain, and quickly were told it's just GERD, leave the hospital, come back if you don't feel better in 2 or 3 days. And then finding out that they had a PE, that's a completely different story. So, risk stratifying patients is really important on the front end. Other cases that are very common, which I'm sure you guys know about, like delayed stroke cases. So timing is of essence there. Although not everyone's a TPA candidate, at least give them the option, or at least let them get evaluated for such. Delayed endocarditis cases, compartment syndrome. We referenced cauda equina, spinal epidural abscesses that go undiagnosed for a long period of time. And interesting cases for me, and we're getting probably into the deep end of medicine, but it's where I love it. It's, respiratory failure. So hypercapnic respiratory failure. A pulse ox, so if you have an oxygen saturation of 89, 95%, and you're still having trouble breathing, doing ABGs is really, really important in a case like that. And it's very commonly missed. It's something where this patient's O2 is looking great. They must be breathing fine. That's not always the case. There's 2 aspects to kind of a good respiratory exchange. And it's not only that you are oxygenating, but, ventilating is a big part of it. So how much PCO2 are you blowing off? That's not something a pulse ox can always identify. And I've looked at a lot of cases where attorneys were actually thinking of turning down a case because patient's O2 sats were at 95%. Like, what can we do with that? Well, there's a couple other ways to ensure that maybe BiPAP or early intubation could have saved the patient in the end. So again, some nuances to some of the cases I look at, but I think probably things that you guys could probably follow along with what you guys are taking on.
So cool. I love this stuff. Even though I'm not a real lawyer, or a real doctor, but I'm slightly closer to being a real lawyer. All right, what else should we know about Expert Institute? What else you want to tell us? Oh, wait, somebody put something in the Q&A. Is it good? Oh yeah, there's a question there. Oh,
All right. Let me take a read. I'll read this one out loud. At a medical center, clerks do not pick up the telephone to talk to their colleagues in other departments to schedule an appointment. They can only send them emails. It takes weeks and even months just to get a date for an appointment, which is scheduled for months into the future. The directors of the department are unwilling to change the system. To whom do you complain inside and out of the center about that and a host of other problems arising from the fact that clerks and doctors cover each other? The quote dynamic group of Prevail, I cover for you today and you cover for me tomorrow. The patients are always at fault. I have cases right for class action. Can you contact me? That's actually a great question. And yeah, we'll be sure to really get a sense. You know, what's interesting is attorneys tell me all the time that some of their, cases off the record come from, quite frankly, hospital staff. It's I think a good check in the system. No one's going to probably be openly telling patients to go visit X, Y, and Z, but many cases come on our desk with that sentiment. It's almost the people on the inside that are looking to really, they just feel like a patient got poor care. Ways that we have leveraged kind of some of these nuances, because you're right, like there is a circle, and it's kind of like cover. But there's a lot of ways to kind of navigate and mitigate now the EMR. So to take it to another level, we've actually even been asked to source Epic EMR experts to audit the actual electronic medical record. So where was this provider when they typed in their note that they returned a phone call from a patient? Where was this provider? Because the note's backdated 5 days after the patient had already passed away when they're signing it. Actually, the provider was on vacation 4 days after the patient died when this note was signed. So there's ways to kind of audit the EMR trail to make sure that much of what's written in the chart is accurate and true. When it comes to the nuances of I guess, referrals and getting patients evaluated, a part of that comes to, the orders being placed, if it was a stat order, if it wasn't a referring attorney. There's some tough things in there though, where optimizing patient care, it's probably sometimes tough to litigate in regards to my office is booked. I can't see another patient to do a colonoscopy for 6 months. Tell me why I need to see it sooner. Is there rectal bleeding? Was there, significant signs that this patient should be prioritized to get evaluated based on their symptoms versus it being, a general elective colonoscopy? So those would probably be some nuances in what I would look at in the chart and the patient's, complaints in regards to what and why their care wasn't optimized.
Awesome. All right. If anybody else has questions, feel free to stick them in the Q&A. Otherwise, tell us something else. What else you got for us? Any other things you want to wrap up with?
No, not too much. We get all types of cases. So what I would say is there's never a case that we really can't support. Initially, when I started, we only had about 15 doctors. So we were, I think, taking on cases that were a little bit generalized and maybe somewhat outside of our scope 5 years ago. That's all changed. So we have ophthalmologists, we have ENTs, we have dentists that are reviewing cases for merit. So, we could obviously review the general cases that come in the door, like general surgeons, orthos, neurosurgeons, radiologists. But I wouldn't hesitate to even just give us a call or shoot us an email, which I'll toss in the chart here in the chat, to just get a sense of, is this something that we can work on? Have you guys worked on something like this before? And I'm pretty sure it's going to be a yes, but we wouldn't say so until we let you know.
I love it. Yeah. Pat's good to just like throw weird cases at too. If you've got like a crazy case and you're like, I don't even know what to do with this. Who is the expert on this craziness? You can certainly stick that in his email and he'll see what he can do with it. He loves a good challenge. All right. Well, this was amazing. Thank you so much, Dr. Moore. We appreciate your time and answering our cruise questions. If anyone has other questions, I'm one of those people that the minute something ends, I think of 10 more questions. Like the second you're in the elevator, it's like, oh. So if that happens to you, have no fear. You can always email us, info@trialacademy.org, and we will be happy to forward you to Pat or Dr. Vora, or we'll tell you to come to the CLE that's coming up on August 10th, I believe it is. So more coming up then. Amazing. Thank you so much.
No, thank you. Really appreciate it. Love being a part of such a great organization. We really love what you guys are doing and hope to stay involved forever.
Awesome. We love you guys too. Thanks. All right. Sounds good, everybody. If anyone needs us, info@trialacademy.org. Thanks for sticking around through the AMA, everybody. We'll see you soon. Bye.